All right, we might start slowly. So hi, everyone. Welcome to the TAPAS lunchtime seminar. I'm Caroline Voyo. I'm a research associate at the University of Cambridge, and I'm part of Focus Area 1 in TAPAS. So for those of you who don't know TAPAS, it stands for Tackling Air Pollution at Schools, and it's a network that brings together stakeholders working in academia, industry, civil society, and public policy. If you would like to join, you're welcome to. I think Kat will put details in the chat later on so you can join the newsletter and get more involved. So this is the fourth or fifth installment of this lunchtime seminar series. Today it's my pleasure to introduce Henriques, who works at CERN in Geneva. He is the technical coordinator for the CERN safety rules in the Occupational Health and Environmental Protection Unit. He's also a member of the WHO expert panel on indoor air risk assessment and is a member of the European Committee for Standardization. So today he will be talking about the CAiMIRA tool that he's been developing along with his colleagues at CERN. And yeah, looking forward to this talk. Before we start, just a few housekeeping rules. Keep yourself muted during the talk and try and turn off your camera as well. Hopefully there'll be time for questions at the end. So please post any questions you have in the chat and we'll have time to ask them and answer them afterwards. So thank you. That's all from me, and over to you, Andre. If you want to share your slides.
Thank you, Caroline. Thank you very much to you, to Kat, and to TAPAS for the invitation. It's a real pleasure for me to be here. I will share my slides first thing. Just a confirmation that you see it well. Good. Okay, so yes, I will talk to you first on some tools for approaches for science-driven policies. And we had developed one specific one during the COVID pandemic, which is called CAiMIRA, which is the technology that I will focus on today. And you propose it as here in this network as a guide for potentially healthier schools and indoor environments. Before going any further, I have to acknowledge the effort which is collectively. So I'm here representing a great team of colleagues and friends in this CAiMIRA development team. So we have a couple of people which are still active, and here it's acknowledge the fact that they're active, enjoying their contributions whenever they have free time. So it's something that was born on a voluntary basis, and I think that spirit also was very nice to work around. We have colleagues that had not so active yet as of today, but they are continuing to engage in our discussions. Whenever we need their help, I will not hesitate to ping them. And then we have, of course, a large amount of colleagues that were really involved in supporting the development, namely on the parts of the model which clearly were out of our domain of expertise. I'm talking, of course, in virology, where we have Dr. Julian Tang, which was a major contributor. I think he's on the call as well, from the University of Leicester. And then we have also Professor Olivia Kaiser from University of Geneva, which is an epidemiologist who also helped us a lot in the model development. And we also have, of course, Alessandro Raimundo, which is a colleague at CERN, which is in the knowledge transfer office, which helps then develop all of these tools and technologies that we developed initially for CERN, help them make way if there's any potential benefit to society. And then I will mention as well, as you also in the introduction, this involvement with WHO, which has been very, very fruitful as well, profiting from their network of experts in the ARIA working group. So Kat asked me to, we discussed, and since I'm here, it would be nice to present a bit just on 2 or 3 slides our organization. So CERN is the European Organization for Nuclear Research. So it was funded in 1954 at the time to look and to study the nucleus of an atom. 70 years later, we have passed that, and so now we are probing even further down the chain of matter. It was founded in 1954 by 12 European states as founding members, and they came together with a unique vision, basically to reunite Europe around a common goal. You know, this was just after the Second World War, and the Cold War has already started. So there was a common goal, which one cannot do any fundamental research for the building blocks of nature if we don't collaborate all together. and basically independent on the ideologies or nationalities. And this notion of science for peace is basically the building block of our organization. Today, we are 23 member states and 7 associated member states. As you can see here, basically, this is a bird view of the Franco-Swiss border in the Geneva region. So you can see the Geneva Lake at the top of the picture, and then even further top, you can already see the French and Swiss Alps. You can see the rings that circulate around the region are the underground accelerators that we have, which are one of our flagship accelerators is Large Hadron Collider, which stems 27 kilometers in circumference, 100 meters underground, going around these villages underneath. Basically, our mission is to try to probe the origins of the universe, and for that, we try to go as close as possible to the Big Bang. And so what we're trying to create is the conditions as close as possible to those that we expect were at the Big Bang. And this is basically to understand what is matter, what is the matter made of, and to probe deeper and deeper into this science. And so we also need to remember that even we have still some things to do in understanding matter, there is 95% which is not made of visible matter that we still don't understand. So it is quite exciting to say that the adventure hasn't stopped and is long from being finished. So we stem on 3 main technologies to perform our research, which is particle accelerators. Here's a picture of the LHC. Particle detectors, where we detect all of the chain reactions from the particle collisions, and computing. We need to compute a large amount of data. And so this, we have basically 4 main pillars that we stem on: fundamental research, technology, training, because we also have an outreach mandate, and of course, collaboration. And outside of these pillars, which with the main vision of fundamental science, in the meantime, during this path towards that, there's some technologies that can be spun out of these research that can be useful for society. Okay, so that's the introduction. Now straight to the topic. So you might be, after these couple of slides, initial slides, you might be asking, so why am I here, right? Not really a lot to do with particle physics and understanding matter, but in fact, I ask myself the same question sometimes, but that's the beauty of it, because in fact, at the end, we all walk on this earth, and we all have things that we share in common, independently on the expertise or on where we work. At CERN, as international organization, we need to ensure the health and safety of our members of personnel, right? Just like in any company has the same obligation vis-a-vis of their employees. So this is exactly what we do. The only difference is that at CERN, we have specific technologies, specific machines that don't exist anywhere else on the planet. We don't have any control group. We don't have any benchmarking. We need to rely on something still to make sure that everyone's safe. And by this, we use a science-driven approach to try to tackle these questions, namely for emerging risks that only exist, for example, in our facilities. But then the benefit of that is when such emerging risk happens in a typical standard setting, like an office, then we can use the same approach that we have been using to a general office, for example, where the offices at CERN can be the same, let's say, in the offices anywhere else. And for this, we use this risk-based approach to tackle these emerging risks. And so I think specifically here in this network, why and how, I think we had a lot also to do with raising awareness specifically in Switzerland on aerosol transmission in schools. Here you see a publication, a paper that we did in collaboration with the University of Geneva, where we actually presented some different non-pharmaceutical interventions to help reduce transmission in schools. And I think here it was basically good timing, because this was published just when the schools were reopening. So it was really, the question was out there, and also it attracted a lot of media coverage, a lot of tweets as well. And I think what we liked about it is that, of course, then it was peer reviewed and published in this journal, but it was also reviewed ad hoc by rapid reviewers, as we call them, and they also found the data reliable. So I think this is also why we also worked a lot on this issue of tackling reducing transmission in schools. Just a quick update on, or just a quick overview of what happened in 2020 from our side at CERN. So we started, the pandemic started right at the beginning of 2020, and we had in the region in Switzerland and France, we went to lockdown around March. And at the time we already saw, let's try to aim for a gradual restart of our activities on site in May. So our first question was, okay, let's make sure that when we welcome back our colleagues to our installations, that we do it and we ensure their safety. And so from this on, I think I read, more papers in 1.5 months than probably all of physics papers in 10 years at CERN. And this is just to say that it was an emerging risk, so not a lot was out there. There was a lot of research done in the past for flu, for example, that was very useful. But anyway, I was not an expert, so that was the case that we had to read a lot. And from that, we said, okay, let's start purchasing masks, because we saw that it was might be effective, and teach people or instruct people to start ventilating their offices independently on what was said. And so this was something that we needed to communicate to our directorate, despite that at that particular moment in time, the public health authorities in our region weren't prescribing the same measures. In fact, it was only a couple of months later that they started to put mask mandates and advocate on the importance of ventilation. And the key here was this science-driven proposal. So the science was there, we were presenting the facts and the literature review. We had some expertise in physics. And then we had to let the directorate decide. And of course, they have to do a feasibility check. Can we buy masks? Where will we buy them? What will be the positive or negative outcome, and impact? And most importantly, what will be the communication plan? Okay, despite having our public health authorities that are not prescribing masks, we decided to do so nonetheless. And this is a very important point, because this will take care of the transparency and the rationale behind the measures. So besides not just saying, okay, you need to use masks, we need to explain why you need to use masks. And this also enabled a qualitative approach, because we can have targeted investment. So instead of all of a sudden we identify that, for example, HEPA filters will do the trick. Well, does that mean that we all now need to buy HEPA filters for every single office? Probably not, because that will probably not fly. So what we need to do is to say, okay, for now, we only have a certain amount of resources. Let's target that for the specific areas which have the worst indoor air quality, let's say, behavior. Okay, and this is basically what we call today CAiMIRA, which is a technology that we developed to convince, in this case, our colleagues at CERN that it was important to prescribe these measures early on. So CAiMIRA stands for CERN Airborne Model for Indoor Risk Assessment. And it's basically a model to assess what is the risk of secondary on-site transmission via the airborne route of respiratory pathogens in indoor settings. And here we can use different pharmaceutical or non-pharmaceutical measures as compensatory measures, or as, let's say, mitigation measures. So first, I think we need to stop for a moment and to understand, I'm sure many of you already know, but what is exactly airborne transmission, right? And here this can be a whole seminar on its own. But I would just, for the purpose of time, just refer to exactly what is written in the WHO website, which is basically viruses spread mainly between people who are in close contact with each other when infectious particles that pass through the air are inhaled at short range. Viruses can also spread in poorly ventilated or crowded indoor settings when people tend to spend longer times. So basically, we clearly see here the distinction between short-range transmission and long-range transmission. The short-range transmission is basically the conversational distance in between two people, where one is exposed to the expiratory jet of the other. Long range is basically what I call the background concentration. So the accumulation of aerosols over time, virus-laden aerosols over time in a given closed space. So I'm sure you've heard about the cigarette smoke analogy. I think for this particular forum, it's more appropriate to use the air pollution analogy, right? So if you're very close to the exhaust of an internal combustion engine, you'll have a lot of toxic fumes all of a sudden. But probably if you spend a lot of longer times in a polluted atmosphere, like in a urban city, you'll not be okay as well. Okay, now this is the model that I'll present. Basically, underneath the hood, let's say that the engine is comprised of this sort of architecture, which is modular, and I'll come to that in a second. It's basically a 5-tier methodology. We first need to estimate what is the emission rate of the infected persons. How many viruses are coming out of a person's mouth as a function of time? With that, we also have to then assume what are the environmental conditions that are biological conditions that allow the removal rate of these same viruses over time as well. So basically, this can be just a simple dilution of the jet as a function of time and distance, or the ventilation, the relative humidity, or particulate filtration, for example. And then the mass balance between both gives you the exposure over time. And with the exposure over time, you can inhale a certain volumetric quantity into your respiratory tract. And if it's absorbed, then you can then try to see what is the response based on the dose that you inhaled that will give you the risk profile of your exposure. And here there are a lot of things. So one important point here is that each class can be treated independently. So each of these, let's say, balls or antibodies can be treated independently. This gives flexibility and update of the different parameters that can evolve drastically once new data is found. The model is entirely stochastic. As we know, there's a large variability of certain parameters. And so we have Monte Carlo simulations to treat those uncertainties. And also we can just basically show the results in any distribution percentile that we want. One important advice that was given, I think by Julian, it was that virus-laden aerosols are not just aerosols. So this is important to see that the multidisciplinary effort is important. The engineers probably think about only the aerosol part, but we also need to make sure that you have the host pathogen interaction, which is also very important and crucial. And so, of course, if viruses were just like aerosols, it would be much easier indeed. This is just a screenshot of the visualization of the application. There will be a demo soon. So it's a model with more than 100 inputs, so it's quite complex, but the idea is that the interface should be as simple as possible for the end user. So then what happens in the engine should be transparent, should not be, should be transparent to the usability. Okay, so what can we use such a tool? There are a couple of ways that we can use it. One is having, for example, a risk score, like showing absolute values. So you put in your input, you have your indoor setting, you know what are the parameters, you know what measures that you want to implement, and here you have the result. You can use it, of course, but I don't think that you're exploiting the potential of such applications. And this is the same for other tools, similar tools that I've seen out there, which are very, very good as well. And I invite you also to check them out. But for me, when I see these type of tools, I see them with another purpose. I see them as risk assessment tools, and that can be tailored for the specific setting. So for example, let's say that all of a sudden we said you need the importance of ventilation. You need to ventilate. Independently, if you have masks, you still need to ventilate. But what if my windows cannot be opened simply? I mean, these are the cases that I heard in the United States in schools. I cannot open the windows. Does that mean that we need to go home? Is there no other thing? Is this really black and white? No, what if we install HEPA filters? Then the HEPA filter will reduce the risk by so much. Well, if we're still not happy, let's reduce the exposure time. Let's try to minimize the time that the students are indoors. Or if it's still not the case, let's prescribe other measures. I'm very talking arbitrarily. So if we change the surgical mask by a properly fit respirator, it will reduce even further, and so on. We can continue this process. And basically, this gives us an idea on where we want to end as our acceptable risk level with all of these measures that can vary. So when I see a lot of discussions, oh, it has to be white, black or white, you need to wear masks, or you don't need to wear masks, or you need to open the windows, but what if I don't open the windows? So I really don't think that the way to go is this black or white type of approach, because you have the black, you have the white, but then let's not forget that there's a big gray zone in the middle. I mean, there's gigantic possibilities that one should not neglect before taking any conclusion. And I think that is the main message as well for why we built this tool. Another important point, which is crucial, is education or knowledge and communication. So this tool can be a vocal for communication out to the public in terms of what are the measures. And we did that as well. And this probably is also important for more scientific community, but then we can also shape this for the general public in terms of more infographics or something more simple, better to understand. But this I found interesting when we discuss amongst our colleagues, where, you know, out of all of the 100 and so parameters, basically the viral load of the infected patient, of the affected person inside the room, is probably the most governing of them all. So depending on the viral load of that person, you can say whether or not it's chances to have on-site transmission in a given setting. And so here, basically, we see that if we are relaxing measures, so we're taking off masks, you know, closing the windows, what we're doing is we're just shifting this Poisson curve to the left. On the other hand, we can, if we're reinforcing measures, this plot goes to the right. So that means that there are more viral load possibilities to which the probability of infection is still low. And so you can see here that basically, if you have the windows closed, this is the blue line, only viral loads up to 6.5 log copies, more or less. This is just an arbitrary example, will be okay. But if you open the windows and prescribe masks, you're basically shifting this to the right, so you're increasing the possibility of more person having higher viral load will still have the same effect, which is not reducing the possibility of on-site transmission. What is also important, and I heard, is the notion of risk. So we've heard that the closer you are to the infected person, the higher the risk of transmission. This is correct. Yes, this is correct, but this is correct if the exposure time is the same in both cases. So what you can say is that the viral concentration is higher the closer you are to the infected person. But if you basically have more time farther away from the person, you can probably come up with the same risk. Depends on the circumstances. So you can see here by this illustration that the further you go away from the person, you need more time to have the same net increase of the dose. So basically, you can have a person that is, let's say, 5 minutes close to someone speaking can probably be equivalent that someone in a background in an office with high concentration or relatively high concentration for 3 or 4 hours, right? So this is quite relative. And I think I always like to communicate this as the notion of exposure time versus the risk. And then again, communication is key in science-driven policy. We have the experience here. Communication equals transparency, that equals trust, and trust, of course, equals increased compliance. And we can also use this for specific guidance for specific settings, like we did in our paper for the schools, where we gave some data, some tips and some guidances. And you can see that we didn't, on purpose, we didn't use absolute values in the paper. We didn't discuss the results as, in this situation, you'll have 10% chance of infection, or 10% probability of infection, or 15 or 20. No, because we don't think that will be the best way to communicate the result. Despite that, we took, for example, if you put certain HEPA filters, you will reduce the concentration by so much, or you will reduce the exposure by so much. And I think that probably that's the reason why it was was also widely publicized, because the message was passed correctly in our point of view. So here, for example, one of the outcomes that we came, in the beginning, there was always this, in terms of natural ventilation, there's always this request or this proposal to open the windows periodically during the day. So for 15 minutes every 2 hours, or for example, in this particular case, let's open the windows entirely during the playground breaks. As what we see here is that it doesn't really gain, we don't really gain that much by opening the windows entirely during the playground breaks. It's better probably to leave it open, but slight opening than opening it in so much or fully only during the yard breaks or the playground breaks. So this was probably useful also. We use that also at CERN to say, yeah, just it's better if you keep them open, even if it's just a small opening than opening it once in a while. Okay, you probably are interested to know, of course, the accuracy of the model, which is important to disclose. Of course, it was peer-reviewed by this journal in a special issue of airborne transmission by the Royal Society Interface Focus. So we had, of course, to benchmark with clinical data and some experiments. But we also did some benchmarking with recorded outbreaks. So the Coral Valley that we all know, and also the bus ride. And we also benchmarked using CO2 data. We really wanted to see if our natural ventilation model was accurate. And you can see here the predictive of a model is in blue, and the CO2 readouts are in orange. So we were actually quite happy about this result. And the short range, so the short range, we basically took a great and amazing work done by Professor Yu Li's research team in Hong Kong, where they did this two-stage interrupted jet modeling. And basically we use that into our model. And so it's a really great piece of research as well. Okay, very quickly, I'm also slightly behind time. This is just an example that I wanted to show you in terms of the classroom. So this is just an arbitrary example where we have full day at the class, 1 hour lunch break, 2 playground breaks, very short, no ventilation, no masks. So you see here, the background concentration is the solid blue. And then we have over time, the accumulation of dose that the student will inhale, or the students that are exposed will inhale over time. So they will increase over time throughout the day. Now, if we include close proximity interactions, for example, in the morning, the infected student was talking to someone, was just listening to his or her colleague that was just breathing towards the face, so it wasn't speaking. You can see that breathing is not so instrumental. But in the afternoon, if that infected student was actually speaking to the same susceptible, you can, and this is the green peak here, you can see that for a short period of time, because it's the time of the duration of the interaction, the concentration is much higher than the background concentration. Okay, I have a quick demo. I don't know if it was very useful, but I will just quickly flash through it. So this is the demo of our calculator where we can input the values. So here you have the room number, the room volume. We have here the use of central heating, which is basically saying that you're drying your air indoors or not. We can choose the location, geographical location, and this will connect to a meteorological data for the outdoor temperature. Then you can pick here the ventilation type. So natural, you have to input some parameters like the number of windows, the height, and the opening distance. You can say, oops, sorry. You can say if down here, if they were permanently open, so during the whole day, or if you open them once in a while, like I was just explaining. Okay, there's no HEPA filter, no masks. Here you can put the total number of people inside that room or in that classroom. You can use either deterministic exposure. You can say that 1 out of those 20 is infected, or you can use a probabilistic exposure based on the incidence rate of that given period in that given location. Okay, and then you can put the exposure presences, and here you can input what are the short range interactions that might occur during the event. So of course this is predictive, so you're predicting what will happen in reality, which is also very tough, but it gives you an idea. Yeah, and then we have lunch breaks below. Let me just fast forward for the benefit of time. We click here, we generate the report, and you have the outcome. So this is all customable, so you can customize this as you want. We give the probability of infection of those that were just exposed to the background concentration that weren't in close proximity, and then the students that had close proximity interactions. As you can see that the probability of infection increased quite so much. And then we have some plots, interactive plots that you can play around with the information. I'll skip that. And then you can go back. If you're not happy with these results, you can go back and say, okay, I have an EPI filter of so much CADR, or I can input a face mask or a respirator, in this case, a surgical mask, and then redo the calculation. And you can see that it was can be considered as acceptable. Okay, one thing that just came out yesterday or this morning was that we have integrated now also the vaccination effectiveness with the help of WHO. We have included the vaccination effectiveness also in the model. Okay, so now I'd like to talk very briefly on the partnership we have with the WHO, which is this ARIA working group. So basically, we were approached, we were in discussions. So CERN and WHO have institutional agreements and collaborations for many years. And we profit from this network to join forces as well. And we knew that there was already the ARIA working group that was being created at the time by Luca and Alice. And so they invited us to participate along with other 18 world-renowned external experts, and their names are well known by most of us. That was nice. And basically the aim of this working group was to define a standardized model to quantify, in this case, SARS-CoV-2 airborne risk assessment through inhalation, and then provide a standardized methodology on how to recommend indoor air rates. And with this, they also wanted to develop a user interface based on the engine that we are using here to put in the general public, so to put in their website for the general public. So these are the main objectives of this ARIA working group. Okay, just before I finish, there's a couple of words on the use of indoor air quality monitors and the link with these technologies. So we all know that the CO2 sensors are surrogate. We can use this for the indirect notion of transmission risk. We've purchased several CO2 sensors at CERN. In fact, we also had the opportunity to visit SAF Technica, which is the company in Latvia producing Aranet. And we all, this I'll not, because I'm sure that in your network, this is a common practice that we can use CO2 data very well, and with a lot of, that gives us a lot of information of what's happening, and especially the air exchange rate for example, decay of CO2. So what we did is we did, of course, some experiments, and here, this is nothing very fancy or state of the art, but we wanted to understand what were the decay rate of different interventions. So either someone left the room and the CO2 decreased because of that, or someone opened the window. So if we had a chance to know just by analyzing the data which is which, we can probably also have an online real-time risk indicator. So this is what we are investigating at the time. At the moment, is to try to identify what kind of slopes will give us, what kind of decay rates will indicate that it was a window opening or someone leaving the room. And we're not ready yet. We still need to work on it, and we're collaborating as well with some colleagues, some startups, to have some more data to be significantly, statistically significant. But the idea is that if we can distinguish between if someone opened the window and someone leaving the room, we can tune the correct parameters, either changing the air changes per hour or updating the emissions. I saw Martin on the call as well, which is a professor from UCL, from CASA, researcher there, and we had a dissertation from one of his students, master's students, where he actually was extending this risk assessment tool to real-time indicators. You can see here they are at real time showing the values based on some input parameters that were taken from ambient sensors. So this was really great project, and the thesis is already available. So thanks for that. Okay, I'm coming to the end. So in terms of dissemination, so I'm glad to be a part of an organization which one of our missions is basically that society profits from some of our technologies. And so we have the KT officer that you can contact if you really want to take a deeper dive into this. It's an open source initiative, so basically everything is open for you to use and reuse as much as you want. There's no license fee, there's no royalties. There's just one thing, which is collaboration. This is the only thing we ask, that you join us if you wish to collaborate, to improve, to use it, to disseminate it for the benefit of whoever needs it. So this is basically the message that you can get from our side in terms of the dissemination of this. The link to the repository is here. You can then check it out. You can just type CAiMIRA Git repository. I'm sure you'll find it. If not, then you can contact us at any time. Yeah, and I had this slide. If you're interested in your network, what I would propose is that in one of your institutes, you set up a web server to deploy the application, and there's all of the instructions in the repository README, and then just basically share that link to that web service in your network. This is something that actually our colleague already did, James. James already created his own web server where you can run the code. But I think it would be beneficial if in your network you do something on your side, because the computation can be not heavy. I mean, any kind of standard computer might do the trick, but some resources are needed on server side compared to typical, let's say, phone type web applications. Yeah, and that's it. So last slide is just to show that it's not only CAiMIRA that we are focusing on in terms of how we can spin off fundamental research to society. There are many other examples. I'm just flashing a couple. That's the examples that CERN technology made its way to medical applications, from PET-CT scan technology, from MRI technologies to biomedical imaging. And then, of course, today it's only possible that we have this meeting online is because of the birth of the WWW. That was, again, a fundamental research this is driven by fundamental research and then disseminated to the public, and probably we couldn't live without it today. Thank you very much.
Thank you, Andrew. That was great. It was really good to hear about everything you're doing, and it's quite impressive what you've done with the tool. There was a quick question just about that before I forget. I think Sarah asked whether the use was restricted. I'm right in saying that this is CAiMIRA is open source, right? And anyone can use
CAiMIRA
it.
is open source. So we deliver the technology, we put it open source, but CERN does not really have the mandate to provide a service. So we don't have a web service with hardware to give to the public. So we give the source code, and you need to then deploy it either locally in your machine or set up your own web service for your own purpose. But this is just the technicalities. The open source is used. There's no restriction to use it.
Yeah, that's great to hear. I'll probably have a play with it because it looks really nice. Then we had a question from Julian as well, asking whether the model takes into account the difference between adults and children when it comes to their age and dependence on respiratory physiology.
It does and it doesn't. So it does not discriminate between age groups. Basically, it takes the full distribution of, in this case, viral loads. I don't know if you're stemming on that or asking other parameters, but if for the case of viral loads, we have the whole distribution, which is taken from meta-analysis, which take the data from each age group. But indeed, this will be probably important for the particularity of schools, where we can probably put a specific distribution for a particular age group. That's a good idea. So we're happy that you can contribute on that.
Yeah, no, I was just wondering, Andre, because I tried this earlier, as you know, and I'm looking at like the respiratory rate and the tidal volume, which is different in kids. So they breathe shorter, smaller, faster than adults, and they have generally higher viral loads to start with as well.
Yeah, they get so I don't know if it was clear, was so clear. the model is built, and I think this is something that is probably different from many other great similar tools. I mean, we can have a lot of examples of great similar tools that are out there. But for CAiMIRA, I think it's made in a way that it's flexible, so that tomorrow, if we need to change the tidal breathing or the tidal volume for a certain age group, we can do it quite easily if we have the data. That's no problem. So that's a good thing about it.
Yeah, that's good to know. And I think when it comes to school, it'd be interesting to have the option to restrict it to, say, if you're looking at primary school and look at those age ranges. If anyone else has any questions, please feel free to add them to the chat or raise your hand if you want to ask them directly. But in the meantime, I might just have ask a question then. I was wondering if you know of any, say, companies or institutions that have used the tool, especially, say, schools, and whether you've had feedback from them, how they used it and how they found it to, I don't know, implement different measures.
So the downside, I wouldn't say it's the downside, it's just the fact of open source is that you really don't control where it's used. So I hope that it's used, unless we are not, most of the times we receive the emails or acknowledgements, but probably there's many other examples that we are unaware of. But we have examples. Well, the University of Geneva, there was a university in Brazil that used it. We had also our partners in the Particle Physics Institute that were using them as well. At CERN, of course, there are some companies that were using it in office buildings. The United Nations also used it. I forgot, of course, the United Nations here in Geneva, and I think in New York, Bangkok. So it has been used, yes.
Thank you. That's very good to know. But yeah, I guess it's the downside of of open sources.
Yeah,
you're hoping loads of people are using it. Yeah, you might not know.
If we really want dissemination, we cannot really say it's a downside, but yeah, if we knew, it would be better. But
yeah. Julian is asking whether they can publish those results.
Which results?
So I'm guessing the results, so like it would be different case studies, right? So results of using the tool in those different settings.
So you can use your tool, you do your own study, and you can publish the results. It's just the correct citation of the model that was used. I mean, like I said, we're not doing any kind of if we use it, we're glad, and just cite us. That's the only thing probably that we say.
That's good to know. So we have another question from James asking whether the results vary greatly with the shape of the classroom and where the students sit. So I don't know if this is something you can take into account.
Definitely. The shape, well, we don't really go into the geometric layout because I didn't mention, but of course that we could have made this model more complex. But then we had also some goals, which is we wanted this to be, in order to be disseminatable in an easy way, it cannot rely on, for example, numerical simulations, because not all computers can deal with numerical simulation. And also it would not probably be so interesting if you click the button, generate the results, and then have a message pass by in a couple of hours and it'll let you know, or pass by in a couple of days. So that's why we restrict a bit the complexity. But so you can change if by changing the shape of the classroom, you mean changing the volume, of course, that makes a point, but changing the layout where the students, the seats are used, that has a major impact, for example, for the close proximity interactions. So you can say, okay, if the student desks are 0.5 meter apart, you can make a simulation with 0.5 meter. And you can say 2 meters apart, you can make that simulation with 1 meter, and you can then know what is the optimal distance to come with the optimal distance in order to put everyone in the room, but also have this kind of risk mitigation for short range transmission.
So it's something you could play with if you look at the short range model bit, right? So saying, okay.
Well, okay, so the interpersonal distance is also a distribution. It's a random variable because you really don't know. If you stick your head up, you gain already 0.5 meter. So it's a statistical distribution, and you can tune it in the tool. So you can go inside and you can change that distribution for a deterministic value. So you can change the distribution and just put 0.5 and it will run the code at 0.5. But it's not something that in the user interface you can do easily.
All right, okay. And then Darpan had another question, which is the model based on a well-mixed room condition? What happens if the pollutants are not well spatially distributed?
So it's a two box model. So where you have the long range and the short range. So basically whatever is further away than 2 meters, where there's enough evidence that the expiratory jet is diluted to the same as the background concentration. I mean, this has been published. So let's say beyond 2 meters, it is considering a well mixed room. But from 2 meters to, let's say, 20 centimeters or half a meter, it is not well mixed. So the concentration changes the closer you get to the occupant, to the infector. So this is exactly because the well mixed model is great because it's easy to implement. It's quite in terms of physics and mathematics, it's there, but it doesn't really meet the epidemiological evidence that's not only epidemiological, the general evidence that the closer you are to the infected risk, the higher is the concentration. Right? This we know, but in the well mixed model, this doesn't take this into account. So that's why we have these two box model where you're in the range of 2 meters or you're not in the range of 2 meters. If you're not in the range of 2 meters, then yes, it's a well mixed model. But if you get closer to it, then it's not the well mixed model. And this is the best compromise to stay within an analytical model, because then you have to go to numerical simulations with CFD and whatnot, and this changes our objective. It's possible, it has been done. There are many studies that do that. But like I said, you press a button, you say, come back some days later. And it was probably good for specific studies, but it wasn't the aim of this particular tool.
No, that's, thank you that's very useful to know. So Julian had another question, which is that it would be, is it a comment more maybe? That it would be useful to see how different users define acceptable risk level, or whether these are defined in the model.
Nope. These are not defined in the model. They are inputs when you set it up. So basically, this is I think, Julian, you touched one of the most important points is and this is the same for any kind of pollutant, right? We can talk about chemical risk, any kind of non-communicable diseases, these kind of things that really notion of acceptable risk is very important. So for the general public, until when do I stop my measures? Until when I accept the residual risk? There's no such thing as zero risk, right? And this is definitely not CERN to specify. I'm hoping organizations like public health authorities or WHO would be more knowledgeable and had the mandate probably to do so, but not definitely at CERN. And this is a parameter that you can tune. So for example, we have what we call themes in the repository. So you can create a TAPAS theme, and you can put your own acceptable risk. You can change the colors of the green, yellow, red. You can do whatever. It's customizable, because of course, whatever we accepted at CERN was also something which is not based on any reference, because it doesn't exist to our knowledge.
Yeah. No, and I think that relates really well to Julian's last comment, which is that it would actually be very interesting to gather that information almost in a behavioral study to see how people react differently to those different levels and what's deemed acceptable or not. So it'd be like, if you want to collate all those case studies, that's something else that could be considered.
We would be happy to help on that, but definitely don't have the expertise to pilot such a study. But we are happy to interesting in what is the outcome and probably contribute. Yeah.
Did anyone else have another question or comment for Andre?